All right, so today we're diving into something pretty fascinating, psychedelic assisted therapy.
Yeah.
And no, we're not talking about, reliving the 60s here.
Right.
This is about cutting edge research.
Yeah.
Using substances like ketamine, MDMA, and psilocybin
Right.
in a very controlled therapeutic setting
Right.
to treat serious mental health conditions.
Uh-huh.
Think of this as like your express lane to
Yeah.
becoming really well informed on this whole topic,
Nice.
with all the key insights from that giant stack of research you provided.
Yeah. Definitely a hot topic right now.
Yeah.
And for good reason.
Oh,
I
yeah.
mean, we are facing a mental health crisis
Right.
with traditional treatments just often falling short.
Totally.
So exploring these new approaches is critical.
Absolutely. And one quote from all this material really got me thinking. It said, "Is mental illness
Oh, yeah.
a disorder of chemistry
Okay.
or a loss of meaning in life?
Hmm.
Could psychedelic-assisted therapy be a way to address both?"
That's a big question at the core of all this research. Yeah. It's fascinating. The studies we'll be looking at here,
Okay.
they focus on those three substances I mentioned.
Uh-huh.
Ketamine, MDMA, and psilocybin.
Okay.
Each one interacts with the brain
Yeah.
in a really unique way,
Okay.
but they all seem to have this potential to create lasting positive change.
Okay, let's start with ketamine.
Okay.
I know it's used as an anesthetic, but what's blowing my mind
Right.
is its potential for treating treatment-resistant depression
Mm-hmm.
and even like rapidly reducing suicidal thoughts.
Yeah, it's amazing.
How does that even work?
It's remarkable.
Mm-hmm.
So while traditional antidepressants focus on serotonin,
Okay.
ketamine works on a different system in the brain, the NMDA receptor system.
Okay.
And this system plays a crucial role in mood regulation,
Uh-huh.
learning, and something called neuroplasticity.
Okay.
Basically, the brain's ability to form new connections and pathways.
So ketamine almost like helps reset the brain's wiring.
Yeah,
I was reading about patients describing this feeling of their brain being rebooted.
that's a great way to put it.
Yeah.
And the research backs it up.
Okay.
Studies show that even a single dose of ketamine
Wow.
can have powerful antidepressant effects,
Really?
lasting for days,
Wow.
even individuals who haven't responded to other therapies.
That's incredible.
Imagine the relief for someone
Yeah.
who struggled for years,
Right.
and with multiple doses,
Uh-huh.
we're seeing even more sustained benefits.
That's huge, especially for those who feel like they've tried everything.
Absolutely.
You mentioned some research on how ketamine affects people differently
Oh, yeah.
based on their past.
Right.
Can you elaborate on that?
Yeah, absolutely. So one study found that patients with higher scores on adverse childhood events,
Okay.
meaning they experienced more trauma early on,
Uh-huh.
actually had greater symptom reduction
Really?
after ketamine treatment.
Mm.
This suggests that ketamine may be particularly helpful for individuals who have experienced trauma,
Oh, wow.
perhaps by helping them process and integrate those experiences.
Interesting. Okay, so here's where it gets even more interesting. Ketamine might also be helpful with addiction.
Yeah.
Really?
Indeed, early research
Okay.
indicates that ketamine can actually help reduce cravings
Wow.
and promote abstinence from substances
Okay.
like alcohol, cocaine, and heroin.
Really?
This is potentially groundbreaking for those struggling with addiction.
Yeah.
As we know, traditional treatments aren't always effective.
So we're talking about a drug that could have a triple impact.
Yeah.
Depression, suicidal thoughts, and addiction.
It's amazing.
That's pretty remarkable. What about potential downsides?
Good question. As with any medical treatment, there are potential side effects,
Okay.
like increased blood pressure or heart rate.
Uh-huh.
However, these are usually temporary
Okay.
and occur more often with recreational use,
Right.
not in these controlled clinical settings.
Okay.
It's worth noting that individuals respond differently to ketamine,
Yeah.
and factors like genetics and even B12 levels can
Yeah.
play a role in those responses.
That makes sense. Everyone's biology is unique.
Right.
And of course, this isn't just about popping a pill.
No.
The counseling aspect seems absolutely critical.
Couldn't agree more.
Yeah.
The therapy component,
Uh-huh.
it's essential.
Okay.
It's about using that altered state of consciousness
Yeah.
that ketamine creates
Right.
as a springboard
Uh-huh.
for deeper exploration and processing.
Oh.
Skilled therapists can help individuals make sense of their experiences,
Right.
gain insights, and develop healthier coping mechanisms.
It's like using the ketamine experience to unlock the door to healing,
Yeah,
but the therapy provides the roadmap
Right.
for navigating that new landscape.
exactly.
Okay, now let's shift gears to MDMA.
Okay.
It's mind-blowing to think that What was once considered a party drug
I know.
could hold such therapeutic potential, especially for trauma.
It's truly fascinating, and the research on MDMA-assisted therapy for PTSD,
Okay.
especially chronic treatment-resistant PTSD, is generating a lot of excitement.
Yeah.
In fact, the FDA has granted MDMA breakthrough therapy designation for PTSD.
Wow.
This means they've recognized its significant potential,
Okay.
and they are expediting the approval process based on these promising early clinical trial results.
Wow, that's a big deal.
Yeah.
So how does MDMA actually help with trauma?
Okay.
I know it's associated with euphoria and connection,
Right.
but how does that translate into healing deep-seated psychological wounds?
It's more than just feeling good.
Okay.
MDMA seems to work by targeting specific areas of the brain involved in processing fear and emotion.
Okay.
Studies suggest it reduces activity in the amygdala,
Okay.
the brain's fear center,
Right.
which is often on high alert for those with PTSD.
Okay.
At the same time, it increases activity in the prefrontal cortex,
Okay.
which is crucial for emotional regulation
Right.
and decision-making.
So this combination creates like a calmer internal environment
Big-
where individuals can access and process traumatic memories
Right.
without being overwhelmed by fear or dissociation.
That's right.
So they're able to revisit those painful memories
Mm-hmm.
without being completely re-traumatized.
Yeah.
Almost like they're observing them from a safe distance.
Exactly. It allows them to process the trauma
Uh-huh.
in a more controlled way,
Okay.
leading to lasting reductions in PTSD symptoms.
Wow.
Imagine being freed from the grip of those flashbacks and nightmares.
That's incredible. And there's even some evidence that MDMA boosts oxytocin,
Yep.
often called the love hormone,
Right.
which could further enhance feelings of trust and connection during therapy.
Yeah.
That's incredible. In one study, a significant number of participants
Yeah.
no longer even met the criteria for PTSD after MDMA-assisted therapy.
That's right.
And these benefits lasted for years.
It's amazing.
That's truly life-changing.
It is. And this is backed up by years of research,
Okay.
particularly from MAPS,
Uh-huh.
the Multidisciplinary Association for Psychedelic Studies,
Right.
who have been at the forefront of this field.
Wow.
But of course, as with any therapy,
Yeah.
we need to be mindful of potential downsides.
Right. MDMA does have a reputation. What are the risks we need to be aware of?
It's crucial to distinguish between recreational MDMA use,
Okay.
which often involves high doses,
Right.
unknown purity, and mixing with other substances,
Right.
and the controlled therapeutic use of pure MDMA
Okay.
in a clinical setting.
Yeah.
In clinical trials, common side effects like muscle tightness,
Yeah.
loss of appetite, or dizziness
Okay.
are usually mild and temporary.
So the setting and dosage are key.
Yes.
But aren't there also individual variations in how people respond to MDMA?
Absolutely. Research suggests that genetic factors can influence how individuals respond to MDMA. For example, variations in the oxytocin receptor gene
Okay.
might affect how someone experiences social connection and empathy under the influence of MDMA,
Okay.
which could then impact the therapeutic outcome.
So that would be a factor.
It would.
Okay, this underscores the importance of personalized medicine in this field.
Absolutely.
That makes perfect sense. Okay, before we move on to our final psychedelic, psilocybin,
Okay.
I'm really struck by this theme of personalized medicine emerging in psychedelic-assisted therapy.
Yeah.
Can you give us an example of what that might look like in practice?
Sure. Imagine a future where
Yeah.
before starting MDMA-assisted therapy,
Uh-huh.
a patient undergoes genetic testing.
Okay.
This could reveal variations in genes
Right.
that we know influence their response to MDMA.
Uh-huh.
Based on those results, the therapist, in collaboration with other healthcare providers,
Okay.
could tailor the dosage, the frequency of sessions,
Right.
or even the type of therapy used alongside the MDMA
Okay.
to optimize the outcome for that specific individual.
So it's like custom designing the treatment plan based on a person's unique biology.
And I think that's where the field is heading. We're moving away from a one-size-fits-all approach
Yeah.
to mental health treatment
Right.
and towards more personalized, targeted interventions.
That's really exciting.
Okay.
Okay, ready to explore the world of psilocybin.
Bring it on.
All right, let's dive in. Psilocybin, the active compound in magic mushrooms.
Right.
Feels almost ancient,
Yeah.
like something shamans have been using for centuries.
Yeah.
Now it's gaining serious attention in
Very
Western medicine.
Yeah,
Right?
you're right. with the FDA granting it breakthrough therapy designation
Oh.
for treating major depressive disorder.
Hmm.
And there's truly compelling research on its potential to help a wide range of people, from those battling depression and addiction to those facing end-of-life anxiety.
It's amazing how this ancient knowledge is now being validated by modern science.
Yeah.
But before we get into the specifics, can you give us a quick breakdown of what psilocybin actually is
Sure.
and how it works in the brain?
Okay, so psilocybin is an alkaloid found in certain types of mushrooms. When it's ingested, it's converted into psilocin in the body.
Okay.
Psilocin then acts on serotonin receptors in the brain, particularly the 5-HT2A receptor, which plays a key role in mood perception and consciousness.
So it's interacting with the same neurotransmitter system as many traditional antidepressants, but in a very different way.
Exactly. And this interaction seems to have a profound impact on brain activity, leading to the altered states of consciousness and the therapeutic effects we're seeing in the research.
Okay, let's start with one of the most impactful applications.
Okay.
Helping cancer patients cope with the emotional roller coaster of their diagnosis.
Right.
From depression and anxiety to those deep existential fears.
The research in this area is truly remarkable.
Yeah.
2 groundbreaking studies. One comparing a high dose of psilocybin to a very low dose, and another comparing a high dose to a placebo, showed that psilocybin led to significant and long-lasting reductions in anxiety and depression in patients with life-threatening cancer diagnoses.
That's amazing.
Even more profoundly, it improved their overall quality of life.
Wow.
And even led to a greater acceptance of death.
That's powerful.
Imagine the peace of mind this could offer someone facing their mortality.
That's incredible. It's not just about alleviating symptoms, but about helping people find peace and meaning in the face of profound challenges.
Exactly.
But is this just for those facing end-of-life issues? Or can psilocybin help with more everyday depression, too?
There's promising research on psilocybin for treatment-resistant depression, the kind that hasn't responded to traditional therapies.
Right.
Studies show that psilocybin can significantly reduce symptoms, with some individuals even experiencing complete remission after just a few sessions.
That's remarkable. And we've talked about the potential of ketamine and MDMA for addiction.
Right.
I'm sensing a theme here.
Yeah.
Was there research on psilocybin in addiction, too?
You bet. There are studies on psilocybin-assisted therapy for both alcohol dependence and tobacco addiction. The results are incredibly promising.
Wow.
For example, one study found that psilocybin combined with therapy significantly reduced alcohol cravings and consumption. And even more impressively, another study on smoking cessation showed incredibly high abstinence rates, with some participants remaining smoke-free even years later.
Wow, that's powerful. Quitting smoking is notoriously difficult.
I know.
So those results are really encouraging.
Yeah.
I also read about a possible link between psilocybin and suicide prevention.
Yes.
Can you tell us more about that?
Certainly to Teddy, exploring the relationship between psychedelic use and mental health outcomes, found that lifetime psychedelic use, especially psilocybin, correlated with lower psychological distress and fewer suicidal thoughts and attempts. Of course, this doesn't mean psilocybin directly prevents suicide.
Right.
But it does suggest a potential protective effect.
Interesting.
Which warrants further investigation.
It's fascinating to see how psilocybin seems to have this ripple effect, impacting not just mood, but also behaviors and overall well-being.
Absolutely.
But we have to address the elephant in the room. Are there side effects?
Those are valid concerns. Fortunately, psilocybin is considered very safe. With a low potential for abuse. Common side effects are usually mild and temporary. Like increased blood pressure or heart rate. However, as with any substance, individual responses can vary. Factors like metabolism, genetics, and even the mindset and environment during the experience can influence how someone reacts to psilocybin.
So set and setting really matter. Just like with MDMA.
Exactly.
And you mentioned genetics. Are there specific genes that influence how someone might respond to psilocybin?
Yes. Research has shown that variations in the 5-HT2A receptor gene, the same receptor that psilocybin binds to, can influence the intensity of the subjective experience and potentially the therapeutic outcome. Some variations might make individuals more sensitive to the effects of psilocybin, while others might make them less sensitive. It really depends.
That's fascinating. It makes me wonder how we might use this information to personalize treatment in the future.
It's an exciting area of research. Imagine a future where genetic testing helps us tailor the dose and type of psychedelic therapy to each individual's unique biology.
Wow.
This could lead to more effective treatments and minimize potential side effects.
That's the future of medicine right there.
Absolutely.
Okay, we've covered so much ground on the potential benefits of psilocybin. But we have to talk about the other side of the coin, ethical considerations. If these therapies become more widespread, what are the implications for therapists?
That's a crucial question. While existing ethical codes for counselors provide a good foundation, the unique nature of psychedelic-assisted therapy demands a more nuanced approach.
So what are some of the specific things that therapists would need to be trained in?
For one, they'd need a solid understanding of the pharmacology of these substances, their potential effects, and how to manage any challenging experiences that might arise during a session. They'd also need specialized training in preparing clients for the psychedelic experience, creating a safe and supportive environment, and helping them integrate their experiences into their daily lives.
It's not just about talking through things like in traditional therapy.
No.
There's this whole experiential component that needs to be managed and guided.
Precisely. It requires a different skill set. A shift from being an expert who interprets and analyzes to being a compassionate guide who supports the client's journey of self-discovery.
I'm also thinking about the intensity of these experiences. They can be profoundly emotional and even overwhelming. How do therapists ensure the client's safety and well-being during a session?
Holding space is a term that comes up a lot in psychedelic therapy. It's about creating a safe and supportive container for the client to have their experience, whatever it may be. The therapist needs to be fully present, emotionally grounded, and able to offer reassurance and guidance without imposing their own beliefs or interpretations.
It sounds like a delicate balance.
It is.
Being present and supportive, but also allowing the client to have their own unique experience.
Exactly. And it's essential to remember that each client's journey will be different, requiring the therapist to tailor their approach accordingly. This type of therapy calls for a deep respect for the client's autonomy and their own inner healing process.
It sounds like the training for this type of therapy would be pretty intensive.
It is.
Are there even programs available yet?
Yes, there are.
For therapists who want to specialize in this area?
Organizations like MAPS have developed comprehensive training programs for therapists interested in providing MDMA-assisted therapy. Other organizations are beginning to offer similar programs for other psychedelics as well.
That's great news. It's encouraging to see that the field is taking the training and ethical considerations so seriously.
Absolutely.
Okay. I think we've covered a lot of ground in part one of our deep dive into psychedelic-assisted therapy. I'm already blown away by the potential of these treatments.
Me too. And we've only just begun to scratch the surface.
So stay tuned, because in part two, we'll continue our exploration of the incredible world of psychedelic-assisted therapy.
Awesome.
Diving even deeper into the specific applications, the latest research, and the potential impact of these therapies on our society as a whole.
Looking forward to it. It's truly an exciting frontier full of possibilities we're only beginning to grasp.
Okay, ready to dive back into the fascinating world of psychedelic-assisted therapy in part one? We explored the incredible potential of ketamine, MDMA, and psilocybin for a range of mental health conditions.
Amazing.
Now I'm eager to delve even deeper into the specifics, the cutting-edge research, and the implications of these therapies for our society.
Let's do it. There's so much more to uncover.
Perfect. I want to circle back to ketamine for a moment. We talked about its remarkable ability to rapidly reduce suicidal thoughts, which is truly life-saving.
It is.
Can you walk us through how this works so quickly? Especially compared to traditional antidepressants? They can take weeks or even months to take effect.
It's a stark contrast, isn't it? Ketamine's speed of action is one of its most remarkable features. While traditional antidepressants primarily target the serotonin system, Ketamine acts on a different pathway in the brain, the glutamate system. Specifically, it blocks a receptor called the NMDA receptor, leading to a cascade of events that increase something called brain-derived neurotrophic factor, or BDNF.
BDNF.
Yeah, BDNF is like fertilizer for the brain, promoting the growth and survival of neurons.
So it's not just changing brain chemistry in the short term.
Right.
It's actually promoting the growth and health of brain cells.
That's
amazing.
Exactly. This boost in BDNF is thought to be a key factor in ketamine's rapid antidepressant effects and its ability to quickly reduce suicidal ideation.
So it's like giving the brain the tools it needs to repair and rebuild itself.
That's a great way to put it.
And this ties into the concept of neuroplasticity, right? The brain's ability to rewire and adapt.
Absolutely.
Yeah.
Ketamine seems to enhance neuroplasticity, allowing the brain to form new connections and pathways.
Right.
Essentially breaking free from old negative patterns of thought and behavior.
It's almost like hitting the reset button on the brain, giving it a chance to create healthier patterns.
That's a great analogy. And what's even more fascinating is that ketamine seems to be particularly effective for individuals who haven't responded to traditional antidepressants. This suggests that it's working on a fundamentally different mechanism in the brain.
It's offering hope to people who thought they had run out of options.
Absolutely.
You know, we focus mainly on ketamine's application for depression, but I know there's growing interest in its potential for treating chronic pain as well.
Oh, yeah, definitely.
Can you elaborate on that connection?
Certainly. While ketamine has been used as an anesthetic for decades, researchers are now exploring its potential as a long-term treatment for chronic pain conditions, such as neuropathic pain, fibromyalgia, and even migraines.
How does an anesthetic, something that numbs pain during surgery, translate into managing chronic pain that persists for months or even years?
It's a bit counterintuitive, but the mechanisms are complex and fascinating.
Okay.
We know ketamine interacts with various receptors in the brain and spinal cord involved in pain transmission.
Okay.
It's thought to disrupt the signals that tell the brain that the body is in pain, essentially interfering with the pain pathway itself.
So it's not just masking the pain.
No.
It's actually modulating the way the nervous system processes and perceives pain.
Precisely. And for some individuals, ketamine can provide significant and long-lasting pain relief.
Wow.
Improving their quality of life in ways they never thought possible.
That's incredible.
Of course, more research is needed to fully understand how ketamine works for chronic pain. And to determine the optimal dosing and treatment protocols.
It sounds like a promising area of research that could bring much-needed relief.
It does.
To millions suffering from chronic pain. Okay, let's shift gears to MDMA. In part one, we discussed how MDMA helps create a safe space for trauma processing by influencing the amygdala and the prefrontal cortex. Can you dive a little deeper into how those brain changes actually translate into lasting therapeutic benefits for someone with PTSD?
Absolutely. Remember, the amygdala is our brain's fear center. It's constantly scanning for threats, and in PTSD, it's often hyperactive. Leading to those overwhelming feelings of fear, anxiety, and flashbacks. MDMA, by temporarily reducing activity in the amygdala, creates a window of opportunity, a sense of calm, where individuals can revisit traumatic memories without being completely hijacked by fear.
It's like turning down the volume on the fear response. So they can approach those memories with more clarity and less emotional intensity.
Precisely. And at the same time, MDMA enhances activity in the prefrontal cortex, the part of the brain responsible for executive functions, emotional regulation, and decision-making.
So this allows individuals to process those traumatic memories with more objectivity, understanding, and control. So it's not just about feeling less fear. It's about gaining a new perspective on the trauma. Integrating it into their life narrative in a healthier way.
Exactly. And this combination of reduced fear and enhanced cognitive control seems to be key to MDMA's effectiveness in treating PTSD. Studies show that after MDMA-assisted therapy, individuals experience significant reductions in PTSD symptoms. Including nightmares, flashbacks, hypervigilance, and emotional distress.
And these changes aren't just temporary, right? We talked about some studies.
No, they're not.
Where the benefits lasted for years after treatment. How is that possible?
That's one of the most remarkable aspects of MDMA-assisted therapy. It seems to facilitate a deep level of processing and integration of traumatic memories, leading to lasting changes in brain function and behavior.
Okay.
Imagine like this, the trauma is no longer a live wire, constantly sparking anxiety and fear.
Right.
It becomes more like a scar still there,
Okay.
but no longer causing pain or dictating your actions.
That's a powerful image. It's not about erasing the memory.
Right.
But about changing the way it impacts your life.
Exactly.
We also touched on MDMA's ability to increase oxytocin, the love hormone.
Right.
How does that contribute to the therapeutic process?
Oxytocin is a fascinating hormone.
Yeah.
It plays a crucial role in social bonding, trust, and empathy.
Right.
MDMA, by boosting oxytocin levels, is thought to enhance feelings of connection and safety during therapy, allowing individuals to feel more comfortable opening up about their trauma and connecting with their therapist on a deeper level.
It's like creating the ideal environment for emotional healing.
Yes.
A safe space where vulnerability and trust can flourish.
Exactly. And this sense of connection can extend beyond the therapy session, helping individuals rebuild relationships and foster a stronger sense of belonging in their lives.
Yeah.
Remember, trauma often leads to isolation and withdrawal.
Right.
MDMA seems to counteract this by promoting social connection and intimacy.
It's like it's rewiring the brain for love and connection, undoing the isolating effects of trauma. And that's not just anecdotal, right? There's scientific evidence to support this.
Absolutely. Studies have shown that MDMA increases prosocial behaviors and feelings of empathy and compassion, even in individuals without a history of trauma.
That's interesting.
This suggests that MDMA has the potential to not only heal past wounds, but also to enhance our capacity for connection and empathy on a fundamental level.
So it makes you wonder.
It does.
What could we accomplish
if
we were able to tap into that potential in a safe and responsible way?
Imagine the implications for society.
Okay, I'm getting chills just thinking about the possibilities.
Me too.
Before we move on to psilocybin,
Okay.
I want to circle back to something we talked about earlier. The potential for personalized medicine in psychedelic-assisted therapy.
Right.
Can you give us an example of what that might look like in practice for someone with PTSD undergoing MDMA-assisted therapy?
I'm glad you brought that up. It's an area that holds immense promise for the future of mental health treatment.
Okay.
Imagine this. A patient with PTSD comes in for MDMA-assisted therapy.
Okay.
Before starting the treatment, they undergo genetic testing. This reveals variations in genes that we know influence their response to MDMA, like the oxytocin receptor gene we discussed earlier.
Okay, so we have a baseline understanding of their unique biology.
Exactly. Armed with this knowledge, the therapist and other healthcare providers can then tailor the treatment plan to that individual's needs. Perhaps they adjust the dosage of MDMA or the frequency of therapy sessions based on the patient's genetic profile. They might also incorporate specific therapeutic techniques that have been shown to be more effective for individuals with certain genetic variations.
So it's not a one-size-fits-all approach.
No.
It's about personalizing the treatment to optimize the outcome for each individual.
Precisely.
Yeah.
And this level of personalization could revolutionize how we approach mental health treatment.
Wow.
Leading to more effective therapies and fewer side effects.
It's truly exciting to think about how far we've come and where this field is headed.
It is.
Okay. Ready to delve into the mystical world of psilocybin.
Let's unlock the mysteries of the magic mushroom.
All right. Psilocybin seems to have this unique ability to induce profound, even mystical experiences. It's not just about feeling better. It's often about experiencing a shift in perspective, a sense of awe and wonder, even a connection to something larger than oneself.
Right.
In part one, we talked about how these experiences can help cancer patients find meaning and acceptance in the face of their mortality. Can you elaborate on how those spiritual insights translate into tangible benefits for people facing such profound challenges?
It's fascinating, isn't it?
It is.
How these altered states of consciousness can have such a profound impact on our well-being.
Yeah.
Think of it this way. For someone facing a life-threatening illness, their world has been turned upside down.
Right.
Fear, anxiety, and existential dread can take over.
Right.
Psilocybin seems to offer a way out of that mental prison, a chance to reconnect with something larger than their diagnosis.
So it's not just about escaping the fear. It's about finding a new source of meaning and purpose.
Exactly. In the studies you mentioned, patients who receive psilocybin often described experiencing a profound sense of interconnectedness,
Okay.
a feeling of unity with the universe,
Wow.
even a sense of transcendence beyond their physical body.
Wow, that sounds incredibly powerful.
It is.
But how do those experiences translate into real-world benefits?
Well, imagine someone who's been consumed by fear and anxiety
Yeah.
about their illness.
Uh-huh.
After a psilocybin experience,
Uh-huh.
they may report feeling a sense of peace and acceptance they haven't felt in months or even years.
Wow.
They may find a newfound appreciation for the simple things in life,
Yeah.
reconnect with loved ones in a more meaningful way, and even face their own mortality with a sense of courage and dignity.
It's almost like a spiritual awakening,
Yeah,
a shift in consciousness that allows them to view their situation from a completely different perspective.
that's a beautiful way to describe it.
And the amazing thing is that these shifts in perspective often translate into real-world changes.
They do.
Patients report feeling less depressed, less anxious, and more optimistic about the future,
Right.
even in the face of a terminal diagnosis.
Powerful.
So it's not just about feeling good in the moment.
Well,
It's about creating lasting changes in mood and outlook.
that's the key. And what's even more fascinating
Yeah.
is that these changes seem to be linked to those mystical experiences, those feelings of awe and wonder and interconnectedness.
Okay.
It suggests that there's something profoundly healing
Yeah.
about tapping into that spiritual dimension of human experience.
Okay, we've talked a lot about the potential benefits of psilocybin,
Right.
but I have to ask, what about the risks?
Oh,
We often hear about bad trips and challenging experiences with psychedelics.
right.
How do therapists ensure the safety and well-being of their clients during these sessions?
Safety is paramount in any therapeutic setting, especially when working with psychedelics.
Right.
First and foremost, careful screening is crucial.
Okay.
Therapists need to assess each client's mental health history,
Uh-huh.
ruling out any conditions that might be exacerbated by psilocybin,
Okay.
like a history of psychosis.
So it's not for everyone.
Exactly.
Yeah.
But even for individuals who are good candidates,
Okay.
preparation is key. Therapists work with their clients to establish a clear intention for the session,
Right.
address any anxieties or fears,
Yeah.
and build a strong foundation of trust and rapport.
It's like creating a safe container for the experience,
Yeah.
a sense that no matter what comes up, they'll be supported and guided through it.
Exactly.
Yeah, yeah.
And during the session itself,
Okay.
the therapist is present,
Huh.
offering reassurance and support as needed.
Right.
Remember, these experiences can be intense and unpredictable.
Yeah.
Sometimes challenging emotions or memories might surface.
Okay.
A skilled therapist can help the client navigate those difficulties
Right.
and integrate them into their healing journey.
So it's about holding space for whatever arises.
Yes,
Helping the client make sense of their experience, even the challenging parts.
precisely. And after the session,
Okay.
integration is crucial.
Mm-hmm.
The therapist helps the client process their experience,
Right.
connect it to their everyday life,
Okay.
and make lasting changes based on the insights they gained.
It sounds like psychedelic-assisted therapy is a real art form,
It is.
requiring a unique blend of clinical expertise, intuition, and compassion.
And it's an evolving field,
Yeah.
with researchers and therapists constantly learning
Right.
and refining their approaches to ensure safety and optimize therapeutic outcomes.
I'm really curious about the future of this field.
Yeah.
Do you think psychedelic-assisted therapy will ever become mainstream?
It's a question on many minds.
Yeah.
There's definitely a growing movement to integrate these therapies
Okay.
into our healthcare system,
Uh-huh.
with the FDA granting breakthrough therapy designation to both MDMA and psilocybin.
We're seeing a shift in the regulatory landscape. More and more research is being conducted, training programs for therapists are emerging, and public awareness is increasing.
So the momentum is building.
It is, but there's still challenges.
Go ahead.
We need to address issues of access and affordability to ensure that these therapies are available to everyone who could benefit, not just those with resources.
That's a crucial point. We don't want to create a system where only the privileged few can access these potentially life-changing treatments.
Absolutely. And we need to continue to do rigorous research to understand the long-term effects of these therapies and develop best practices for their use.
That's the key, responsible and ethical implementation.
Exactly. But I'm optimistic. I believe that with continued research and thoughtful integration, psychedelic-assisted therapy has the potential to revolutionize how we approach mental health and well-being.
Okay. I'm feeling inspired.
We've covered so much ground in this deep dive.
We have.
Any final thoughts before we wrap up part 2?
I think the most important takeaway is that we're witnessing a paradigm shift in how we understand and treat mental health. Psychedelic-assisted therapy offers a new lens, a new way of looking at the human mind, and its potential for healing and transformation.
I'm excited to see where this journey takes us.
Me too.
Stay tuned for part 3, where we'll explore the broader societal implications of psychedelic-assisted therapy. Okay, welcome back to our deep dive into psychedelic-assisted therapy. We've explored the incredible potential of ketamine, NDMA, and psilocybin for a wide range of mental health conditions, from like treatment-resistant depression to PTSD and addiction.
It's been amazing.
Now I'm curious to shift gears a bit and explore the bigger picture.
Yeah, that's where it gets really interesting.
If these therapies become more mainstream, how might they reshape our society's views on mental health? Consciousness and even spirituality.
It's a big question.
Exactly. Let's start with mental health.
Okay.
Right now, there's still a lot of stigma surrounding mental illness. It's often seen as a weakness or something to be ashamed of. Do you think psychedelic-assisted therapy could help change that perception?
I believe it has the potential to be transformative.
Okay.
Think about it. If we start seeing these therapies integrated into our healthcare system, alongside traditional treatments, it sends a powerful message that mental health is just as important as physical health.
It normalizes the conversation, making it more acceptable to seek help.
Precisely. And as people become more familiar with the science behind these therapies and see the incredible results, it challenges the notion that mental illness is a character flaw or a sign of weakness.
It reframes it as a condition that can be treated effectively, just like any other health condition.
And what's so powerful about psychedelic-assisted therapy is that it addresses not just the symptoms, but also the underlying causes of mental illness, helping individuals heal on a deeper level.
Okay, that makes sense. But let's talk about consciousness. It's a complex concept, but these therapies seem to have this unique ability to expand our understanding of what consciousness is and what it can do.
It's fascinating.
What are your thoughts on that?
That's one of the most fascinating aspects of this work.
Yeah.
Psychedelics have the ability to induce these altered states of consciousness that challenge our everyday perception of reality. They can show us that there's more to the world than what we can see, touch, taste, smell, and hear.
It's like opening up a whole new dimension of experience.
Precisely.
Yeah.
And those experiences can be incredibly profound, leading to insights, breakthroughs, and a sense of interconnectedness that can be life-changing.
It's like expanding the boundaries of what we consider possible.
Exactly. And these experiences often challenge the materialistic worldview that dominates Western culture, suggesting that consciousness may be more fundamental than matter. It raises these profound questions about the nature of reality itself.
Wow, that's pretty mind-blowing. Okay, let's talk about spirituality.
Okay.
We've touched on this throughout our conversation.
We have.
But I'm curious to explore it further. Do you think psychedelic-assisted therapy could have an impact on our society's relationship with spirituality?
It's an intriguing question.
Yeah.
And one that sparks a lot of debate. I think it has the potential to bridge the gap between science and spirituality, showing us that these two realms aren't mutually exclusive.
So instead of seeing them as separate or even opposing forces, we might start to see them as complementary aspects of a larger whole.
Exactly. Psychedelic experiences often have a spiritual or mystical quality to them. People report feelings of awe and wonder, sense of interconnectedness with everything, even encounters with entities or beings they perceive as divine or spiritual.
Those are the kinds of experiences that are often associated with religious or spiritual traditions.
Right. And what's so fascinating is that these experiences are now being studied within a scientific framework.
Wow.
Researchers are using brain imaging techniques and other tools to try to understand what's happening in the brain
Okay.
during these states of consciousness.
So it's like we're starting to unravel the mysteries of the spiritual experience through the lens of science.
Exactly. And this could have a profound impact on how we view spirituality.
Right.
It could help demystify these experiences, making them more accessible and less taboo.
Right.
It could also lead to a more integrated understanding of ourselves and the universe, one that embraces both the scientific and the spiritual.
It's like we're expanding our definition of what it means to be human.
I think that's a beautiful way to put it.
Yes.
Okay, we've covered a lot of ground today. From the specifics of ketamine, MDMA, and psilocybin to these broader implications of these therapies for society.
It's been fascinating.
Any final thoughts you'd like to share with our listener?
It's been an incredible journey exploring this topic with you.
It has.
I think the biggest takeaway for me is that psychedelic-assisted therapy represents a paradigm shift in how we approach mental health and well-being. It's not just about treating symptoms. It's about healing on a deeper level, expanding our consciousness, and connecting with our full human potential.
I couldn't agree more. We're at a turning point. And I'm incredibly excited to see how these therapies continue to evolve and transform our world.
And to our listener, thank you for joining us on this deep dive.
Yes, thank you.
We encourage you to keep learning, keep asking questions.
Absolutely.
And keep an open mind as this field continues to unfold.
It's an exciting time.
Until next time,